Alrighty, hello guys. My name is Anna Cordero, and I am doing my presentation on the use of personal electronic devices in anesthesia. From this moment on, I'll be referring to them as PEDs. My paper focuses on the benefits and risks of PEDs in the anesthesia practice world. Alrighty, so as we know, smartphones are part of everyday life, and clinical care OR is not an exception. They are there as well. They provide quick access to resources. You can quickly check an email. You can go into your applications, look up drug dosages, use your calculator, etc. They also bring infection, distraction, and privacy risks. So the goal is really to balance usefulness with safety. So my personal experience that I've had using PEDs in healthcare is with Rover. Rover is one of Epic's healthcare applications for mobile devices, and you can review patient data, complete documentation, scan your medications, etc. It's a really nice tool to have. And what I found on the internet was Wellstar Health System in Georgia gave nurses smartphones equipped with Rover, and they saw an 80% increase in documentation completed in real time and 24,000 more patient IDs and medication barcodes scanned in the first 6 months. So this improved safety, improved accuracy, and a lot of the nurses reported happy, positive feedback with using Rover. I mean, I myself have used Rover and I agree. I feel that it made scanning things easier. If the computer was taking too long, I'd pull out the phone, and the phone was provided by my facility. And we went through training on how to keep it clean, etc. But this is one of those examples of how you can use your PED in practice. So technology in healthcare has evolved, especially, through electronic health records. Before we did paper charting, now we have all these fancy monitors and all these applications. And using your phone is kind of that next step in digital care. Later on in this presentation, you'll see like emerging technologies, and we'll get there. But big thing with this is integration of these PEDs requires hygiene and privacy awareness. So with professional standards and regulations, there are guidelines that ensure that your PEDs support patient care safely. They exist at multiple levels. There's professional organizations such as the American Surgical Technologists, the American Society of Anesthesiologists. They all have statements on PEDs, and a lot of them talk about, proper disinfection, and using them only when needed. Avoid non-essential use, and then hospitals also will talk about adding encryption to make sure that the information is safely secured. So with legal and ethical concerns, HIPAA is a big one. HIPAA violations from unsecured texting or email, that's the big deal here. You want to make sure that you're not taking photos of your patients. Like, not only can you, get malpractice claims, but it's also a huge hindering, it's a huge hinder. Your job is to protect that patient, and your patient trusts that you're going to protect them, and when they're under anesthesia, they can't advocate for themselves. So that's a big one. Providers must protect patient trust. Even small lapses, casual texting, can lead to major privacy or safety issues. When you're in the OR and you're like, oh, I got a text, don't take that minute to text back. Only use your phone when it's needed. Ethics and professionalism are central. So with patient safety risks, there have been various studies on bacteria on cell phones in healthcare. And phones do carry bacteria, in fact, lots, including MRSA. And so contamination increases infection risk, not only to yourself, but to your patients, right? You're touching your phone, then you're touching the patient, then you're touching your nose. So distraction endangers vigilance in anesthesia. That's something to keep in mind. There are various infection control strategies. Hand hygiene alone is not enough. So you want to make sure that you're using alcohol wipes. Some facilities go as far as giving their staff like UVC disinfection boxes, protective cases, and then combined cleaning and policy enforcement for best results. So just make sure that you're cleaning often, following the rules. And it's kind of hard, right? You have to do that before and after each case or before you touch anything. So there is multi-methods cleaning options. With regards to, another issue with using these devices in the OR is distraction and vigilance. So non-clinical device use lowers vigilance, which makes sense, right? If you're looking at your phone, you're probably not looking at your patient. So you really have to be careful with when you use your phone. Not only can it cause harm to your patient, right, which would be the worst thing, but among your team members, it can be perceived as unprofessional in the OR. And each person is responsible for staying present and ensuring patient safety. Another issue that came up during my research was device interference. So specifically, there has been studies that show that phones can actually affect like heart monitors, pacemakers, etc. The FDA made a statement, and their recommendation is to keep the devices at least 6 inches away from that device. So hopefully, you're not right there. And maybe that recommendation is for the patient themselves to not have their device up on their chest, but it's still a risk and caution is necessary. Privacy and security, we talked a little bit about this. So as we know, right, when we make our passwords, they have to be a certain length with a certain amount of characters. So you want to secure data with encryption, passwords, right? And then there's the risk that you lose your phone. So that's a big one. You really want to be careful with your phone. If you lose it, there's protocols. You have to let your employer know if that is the case. Some employers do offer phones that you can use there, like you clock in, you grab your phone, and then before you clock out, make sure it's disinfected and you dock it and you leave it at your facility. So that's a nice option, so you don't have to worry about, leaving the facility with that phone. So hospitals can support these communication systems. And then workflow benefits, as we know, they improve communication and decisions. How we saw with Rover, right? You can send messages to providers through Rover, which is very easy. So if you need to get a hold of a doctor really quick, instead of having to page them, I mean, some still do paging, but you can send them a quick message. Also, there are various anesthesia apps like Anesthesia Central or Vargo, and you can pull up that app real quick, look up a drug dose that maybe you haven't used in a long time, but this specific case is using that medication. And it's also a way for you to make that calculation quickly and have the information there. So it does improve your communication and your decision. Let's see. All right, so emerging technologies. The future is bright. There is a lot coming out. There's so many things I've seen. I get ads on my personal phone about these technologies. I see for example, the stethoscope that connects to your phone, and you can like download the rhythm. There are ultrasounds that connect to your phone. More and more uses coming from our PEDs into healthcare, and for hospitals, it makes sense to use PEDs, right? Because if you already have a phone, and all they have to do is figure out the apps, it can be a lot of money saved for hospitals to not have to buy you a technology that you already have, but instead use what you already have to their advantage. So something most people have. Most, not all. In conclusion, PEDs are valuable, but they do carry risks. Responsible use protects patients and providers. And, the big thing is that you have to balance convenience with safety and professionalism. It's like a double-edged sword, right? You need to make sure that you are using that phone appropriately, responsibly, making sure it's clean, and keeping an eye on your patient. Vigilance is key. But, phones are not going away. It's more just how are we going to use them to our advantage and keeping our patients safe. There are my references, and I hope you enjoyed my presentation. Have a good day.